Ready? Welcome. Good evening to our second in our series of educational talks or webinars or just meetings about what's going on in our city. And tonight we're going to talk about poverty in the city, how it is there, what to do about it, what we are doing about it, and next steps. We have a distinguished panel tonight, and Shannon will introduce our distinguished panel. And before I turn this meeting over to Shannon, I just want to tell everybody, I can't believe it's 10 days till Thanksgiving. And then a couple days after that is Hanukkah. So if I don't get a chance to wish you all a very happy and healthy Thanksgiving and a happy Hanukkah for those of you who celebrate. Shannon, it's all yours.
Thanks, Elaine. Yes, and thank you everyone for joining NCJW Greater Dallas tonight as we engage in conversation about poverty in Dallas. So poverty is a truly large umbrella word that encompasses a constellation of human conditions. Things like low or no income, low savings rates, wages, food, health, housing, education, transportation, all of these vectors impact an individual and a family's ability to support themselves. So the work of NCJW in advocacy, education, and service has always been directed at addressing, ameliorating, and hopefully one day ending the causes and symptoms of poverty. So in order to do our work well, we need to really continually build our understanding of tonight's essential questions. What is the state of poverty in Dallas today? For persons of color and female heads of households with children, what has changed since the mayor's task force on poverty in 2018 and since the onset of COVID? And really ask ourselves this question: what will it take for those with the fewest resources to recover and to prosper? So tonight, I'm so happy to welcome our panelists, Regina Montoya, Ellen Magnus of Family Gateway, and Kate Rose Marquez of Wings for Women and Families. And I'm really looking forward to engaging in this conversation this evening. These amazing women bring to us their diverse experiences and perspectives as community leaders and leaders of organizations that seek to address and remove the barriers that come from poverty, with the ultimate goal of ending intergenerational poverty. So welcome everyone and welcome panelists. Before we get started with the essential questions, I'm going to ask the panelists to do a little bit of quick introducing of themselves and let us know what they've been up to and the work that they do with their organization. So Kate Rose, would you mind starting us off?
We might need to have someone go first. I think my dogs are barking. So let's have Ellen go first and I'll get the dogs calmed down.
Okay. Ellen, do you want to hop in?
I'll be glad to. I'll be glad to. I left my dogs in another place, so I'm happy to jump start us. I'm Ellen Magnus. I'm president and CEO of Family Gateway, and Family Gateway provides services to families with children who are experiencing homelessness. And this is a population of homelessness that we don't often think about. So we typically think about the guys under the bridges, the people on the corners, but we very rarely see families with children because they're hidden. They're not out on the street. They're sleeping in cars. They're in hotel rooms. They are bouncing around from place to place. And we provide services to families who are right at that edge of homelessness or who have already dipped over into homelessness. And so we have a 24/7 helpline where families can call in and receive services, which don't always include shelter. So a few years ago, we expanded our service delivery to incorporate some prevention of homelessness, and we've been very active in eviction prevention of late, as you can imagine. And so we have the only emergency shelters in Dallas County that will offer services to families of any kind. So whether that's a single mom with kids, a single dad with kids, a married or unmarried couple with kids, same-sex couples with kids, grandmas raising grandkids, they're all families to us. And we want to help them come into care and rebound and get back into housing and get stabilized as quickly as possible. So I'm excited to be with you tonight. We've been very busy of late and happy to share that with you.
Great. Thank you. Kate Rose, are you?
I think they're quiet. We'll see.
Okay.
I gave them a bunch of treats right before this, but we'll see. So I'm Kate Rose Marquez, and I am the CEO of Wings. And Wings is the former YWCA. So we're a 113-year-old entity with about an 8-year-old name. The core of what we do is we empower women, we fight poverty, and we impact generations. And we do that through 2 distinct programs. One is called the Nurse Family Partnership. It is a program that supports women, low-income women, it's their first pregnancy, to qualify for this program. The income ceiling for the individual woman is $24,500 a year. And we work with these women. They come in prior to 28 weeks of their pregnancy. We work with them. We have our staff, RNs, will go and do home visits once or twice a month until the baby is born. They're doing health, nutrition, parenting skills, etc. Once the baby is born, that nurse then has the baby and the mom become our patient. And they are patients for till the baby's 2nd birthday. And they do at least 60 in-home visits. We do, again, health, nutrition, social emotional development, again, parenting skills, and really as a support for the mom. So that's half of what we do. The other half of what we do is we do financial literacy and financial one-on-one coaching for women. We have a suite of curriculum, everything from the basics, financial one-on-one. We have a 4-week cohort that joins every 4 weeks. We start over, and it's just basic 101. What is a budget? How do I create a budget for my family? Everything from that to negotiating for a raise with your boss, or how to buy a car, etc. But we also do that one-on-one coaching where women can come and sit down with one of our staff and get hands-on, dedicated one-on-one support, making their dreams turn into goals and goals into reality. So that's what we do. And we serve 92% of our clients are women of color, and 80% of them make $38,000 or less a year.
Great. Thank you.
Mm-hmm.
Regina, are you able to?
Thank you so much. And what an honor it is to be with these extraordinary women. And Shannon, thank you for this invitation. And most importantly, to NCJW for all you've done. My name is Regina Montoya. I am an attorney. I was the general counsel for Children's Medical Center, but I think what's more important tonight is that I also chaired the Mayor Mike Rawlings Task Force on Poverty for about 2.5 years. I was one of the co-chairs, and before that, co-chair as well. And I think what's so important as we were looking through some of these materials and hearing from these other panelists is the impact that NCJW has had on the Nurse Family Partnership. As we were thinking about families that couldn't find housing, this was Mayor Annette Strauss's dream to ensure that families could also find this kind of shelter when we were looking at other areas that didn't get that same kind of analysis. So to be here tonight and to know that I'm with some of the most extraordinary women that have made such a difference and will continue making a difference is really something that I'm just so thankful to have this opportunity. So thank you.
Great. Well, I'm just going to jump right in with you, Regina, and ask you if you can set the stage for us a little bit, giving us some of the background. What were some of the significant findings from the 2018 commission, and how have those changed or stayed the same over these last 3 years with the intervening pandemic?
Well, thank you for that question. And I think what's really important for us is we started in the Mayor's Task Force on Poverty. I mentioned that I was the general counsel for Children's Medical Center, and I had the opportunity to speak to Mayor Rawlings about some of the issues that we were finding in a publication that I was one of the editors, and that was called Beyond ABC. And as we were going through some of the numbers, I started looking and seeing that there was this extraordinary number of children living in poverty in Dallas. And as I started doing a comparative analysis, I discovered that Dallas was tied with Philadelphia as the two worst big cities in America for child poverty. We were at almost 38% of our children living in poverty. As a result, Mayor Rawlings started thinking about these other aspects, and the Mayor's Task Force on Poverty began at that point. And as we got into the issues, and I think I was very glad, Shannon, that you were describing the various parameters of what we consider poverty. Sometimes we think of poverty of those who are unsheltered and are living under the underpasses, or we might think of folks that are living week to week, but we don't have all of the numbers. What we decided to focus on was something that was really prevalent in Dallas, and that was the issue of the working poor. Those people that were working 40 hours or more. And remember, we've had these issues with insurance that if you don't work a certain number of hours, your employer doesn't have to provide the insurance. So you'd find people cobbling together jobs because they weren't getting that opportunity. And the other thing that has happened in Dallas that people didn't recognize as we first started on this journey through understanding these issues of poverty is the extraordinary demographic changes that we've seen in Dallas. Dallas then and is now has been a majority minority city for decades. So has the county. And one of the biggest changes in Dallas has been the increase of Latinos, of Hispanics into Dallas. Dallas right now is 42% Hispanic. It is 29% white non-Hispanic and 24% African American. And then when you look at the numbers, kind of dig down a little bit more deeply, we're a quarter foreign born. 43% of Dallas speaks another language other than English. It's an amazingly diverse, exciting city, but not with the kinds of numbers that people will typically think about. As we looked then, what was it that was causing this kind of child poverty and these other issues? We hit upon the issue of drivers of poverty. What is it that really creates these? Now, I will tell you, I was working with a lot of business people on this, and they said drivers of poverty. Okay, let's list those, and then let's get the magic bullet. And if we just take one or two of those drivers of poverty, poof, amazingly, poverty will be gone. It doesn't work that way. It's called systemic issues that are in our system that we have to deal with. So if we really want to deal with the issue of poverty, it's not looking at one or two drivers. It's looking at a whole system that has been created, particularly in our city, where over the years, there's been a sharp decline in median income, and that has created a number of have and have not neighborhoods. A lot of that is based on racial and ethnic backgrounds, where you'll have fewer white non-Hispanic families living in poverty versus Hispanic and African American populations or populations of color. So that was one big driver of poverty. Another driver of poverty was something that Kate Rose was talking about, and that's the high poverty rates for single women heads of household with children. She was mentioning the numbers of, and I'm sure you'll go into it a little bit more about those percentages of how it was under $40,000 that you had mentioned. But a family of four under, say, about 25,000, that's what's considered living in poverty. But could you ever live as a family of four on 25,000, or the numbers that Kate Rose said? That's one of the issues that also confronted us. The other one was one that probably any of you who are particularly involved in nonprofits knows. It's the lack of affordable transportation. That kept bubbling up for us because, and you'll see that in the pandemic times. Remember all those cars lined up to get food and all that. What happens to you when you don't have a car? What happens to you when you're trying to just cobble together, making sure your car works this week, and then if it doesn't, you've got to get a new tire or whatever? What do you do? And our transportation system doesn't necessarily work for you to be able to get from point A to point B in any period of time that you can, that will make it cost effective for you to be able to live. Another one is the lack of home ownership or high rental percentages. Dallas has a very high rental percentage of people living in Dallas. And we did sort of comparisons to give people sort of a benchmark of how we were doing compared to a lot of Texas cities. And we did some of that also with other cities as well. And the issue of poverty rates by housing really came to the forefront because remember, for most people in America, what is your biggest financial asset that you have? It's that home that's got the equity that you are able to build up. But what happens when you don't have that and you don't have that kind of safety net? That's another issue. Another is the neighborhoods of concentrated poverty, and those have been increasing in Dallas. And when we talk about post-pandemic ideas and what has been a big issue, this has been particularly pernicious and particularly difficult for families because they're living in these areas of concentrated poverty. And what happens when you live in a neighborhood of concentrated poverty? Guess what? Your grocery stores start disappearing. Those little mom and pop stores that sometimes make the difference in people's lives, the dry cleaners, you think about all of those little stores that you see in your corner, the little restaurants. If you live in a neighborhood of concentrated poverty, those start disappearing. And it just becomes more and more difficult to bring those neighborhoods back into a situation that will work for everyone. Another one, and we've mentioned it, were the high number of households with children living in poverty. I mean, who could imagine that we would be tied with Philadelphia? And right now, even though Philadelphia is now the worst, Dallas has done better because we've talked about some of these issues, come up with some solutions. Still, 3 of the 4 worst cities for kids living in poverty of the million plus cities are in Texas. They're San Antonio, they're Dallas, and they're Houston. So that gives you an idea of maybe safety nets that aren't working in our state legislature as an example. And the other is that there are so many more families with children living in poverty. Mayor Rawlings did not let me use this as a driver of poverty, but I'm going to share it with you all anyway. One of the drivers of poverty, I said, is, oh, when you have children. And he said, what do you mean when you have children? Well, think about this. If you're in a minimum wage job, and you're making sort of do by yourself, you add a child to that mix, you are now living in poverty. There's just no way to get around it. And so we didn't put that in. We kind of used the euphemism of too many families with children living in poverty, but it really was that. And the reason for that is that we have so many low-paying jobs. And part of that is because the lack of educational attainment in Dallas is low. When you look at the number of people who have more than a high school degree, a college degree, associate's degrees, we are at a much lower scale. But what are the kinds of jobs then that pay better? Those that have education, or if you can get into those tend to be the ones that have more churn on it and haven't paid the kinds of wages that will allow you to have what they call a living wage. So that's the other part of it. And so fast forwarding really to give everyone a sense of where we are on this. I did mention the lack of limited English proficiency residents, something that we've really been talking about. And one of the things that we really pushed was for an office of welcoming communities. We call it an Office of Immigrant Affairs. Now it's welcoming communities, but they're really focusing in on how do you get people to learn English, because that helps you get better paying jobs if you can speak English. And then our high teen birth rates. Those were all the ones that we looked at. There were about 9 drivers of poverty, not including the one that I had mentioned before that I wanted to include. But what I think is important now is to see where we are right now. You kind of have now sort of a benchmark, and that was before COVID. But what happened after COVID? And I know you're going to hear this from these fabulous speakers afterwards about how they're addressing some of these issues. But as we mentioned in the neighborhoods of concentrated poverty, what then happened as the pandemic occurred, remember, it was already difficult to find jobs and stores, anything retail that were in these areas of concentrated poverty. It got even worse during the pandemic because those were some of the ones that were just scraping by anyway. And so when the pandemic occurred and there were the closures, those were some of the first ones that ended up becoming shuttered. Remember, we talked about that transportation issue? Well, then that just made it that much more difficult for those neighborhoods because now people didn't have any options to be able to have jobs in their area. And that was one of the increases we saw during this time. And I should mention, when I mention these numbers, I am looking at a study that Every Texan, which used to be called Center for Public Policy Priorities. Full disclosure, I'm on their board, but they made a presentation to the city, one of their committees in August. And so this is sort of a summary of what they're doing. I think we're going to be getting the actual report in January, fingers crossed, but this is sort of where this is coming from. Another one is the issue of unemployment scores. And already African Americans had the highest unemployment rates in the years right before the pandemic. Now it's disproportionately affected African Americans even more, and it's creating more unemployment, which then, of course, as you can imagine, increases the poverty levels. Another is this issue of working poverty. And Hispanic residents who are full-time employees had higher poverty rates in the last couple of years before the pandemic. After that, they were typically in the jobs that became particularly affected. These included sites that were closed, they reduced hours or wages, and then exposed workers to higher positivity rates for COVID. And so you saw more illness in the community. One huge area that we have all got to start addressing, and we haven't been doing it, is the housing cost burden. You know, all of you are hearing about these these amazing numbers, you know, houses that are only on the market for a day or two, and, you know, and you have to, you know, stay on it just to be able to put a bid in and all of this. Well, this isn't something that you're going to be seeing here, but thinking about the fact that your gentrification, and if you had those issues, you're renting, you can't even think about trying to create some equity, etc. Rates fluctuated from 37 to 32% of Black households experiencing housing cost burdens in 2018 and 2019. So 1 out of every 3 African-American residents living in our community face those kinds of burdens. And then I will conclude with just a couple of others, and that's on the healthcare side. You know, our problem still is that we have too many people who don't have insurance. And part of that has been based on the kinds of jobs that they have that have been maybe lower skilled, maybe not more temporary jobs. We're hopeful that now that some of the wages are going up for some of these positions, that those kinds of benefits will happen. But right now, we're not seeing that. So Hispanic residents were by far the most likely to report not having a regular doctor, which is 47%. And maybe one that I do want to mention too are the chronic disease numbers. Every Texan is really reviewing these numbers because this is one of those indicators that doubled in terms of severity. White residents went from being 2.7 to 1.7 times more likely to be diagnosed with chronic disease than other residents, but risk factors for increased COVID-19 morbidity disproportionately affected Dallas County residents of color. And it was a huge increase that we saw. And, you know, you read those in the newspapers, the anecdotal ones, but it was clearly an issue, partly because of the jobs that we're in. So I think that gives you a sense of sort of the baseline of what we're seeing and what we saw before the pandemic. Some things got a little bit better, where as a community we came together, SNAP benefits, food things, the independent school districts. But even during that time, the nearly 350,000 cases, we saw an increase in the SNAP, you know, which used to be the food stamp kind of program. So as you hear our other speakers, you'll see some of these kinds of under the baseline that people are talking about that we're seeing that are creating this kind of havoc in our community. And this kind of presentation and this kind of discussion couldn't be more important. Thank you.
Great. Thanks so much, Regina. That really, you know, sets the stage and gives us a place to jump off from. So Ellen and Kate Rose, does that, and there was a lot of information there from Regina. Does that information ring true with what you're seeing in your organizations? Or have you made adjustments based on the changes over time, especially during COVID?
I can tell you for Wings, we have seen these changes in real time over the last year and a half, specifically when we do our financial literacy courses and our one-on-one coaching. There's a lot of data that we pull in to benchmark how people are moving along, improving on that financial capabilities index. There's a lot that we look at, but the 3 core ones, when I share the work we do on that side of our programs, is how women are able to increase savings, decrease debt, and increase credit scores And I can tell you that our prior fiscal year, our numbers were 74% of our clients showed an increase in savings, averaging a $1,400 increase, 60% increased their credit score, 54% decreased their debt. In the next year, this most recent, those numbers dropped by about 20 points apiece across the board. Now, what I say, I'm more of a glass half full person, is I say, okay, well, maybe only 54% increased savings, but let's think about this. These are women who make $38,000 or less a year, and yet they still were able to save some, and yet they were able to decrease that debt. But we saw a lot drop off. And so we have seen the impact of the pandemic. We have seen the impact on a lot of our curriculum. We got it and changed from going to how to negotiate a raise with your boss to how to negotiate with your creditors. Same skills, unfortunately, different conversation. So we saw a lot of what we did. We adjusted to meet our community where they needed us at that moment, and still are doing that. But absolutely what Regina has been saying is rung true.
I completely agree. So let me give you a few insights into our work. So the families who come to us typically make 30% of the area median income, so extremely low poverty. And their contribution towards their housing is well over what the recommended rate is. So for all of us on this call, the recommended rate, if we go in for a mortgage or to lease an apartment, it's expected that we would contribute about 30% of our income towards our housing. Our families are contributing 50 and 60% of their income towards their housing. So a car breaks down. A single mom with a disabled child gets called to come and pick that child up from school 3 times in 1 week. They now can't earn enough in that month to pay the rent because they don't have sick pay benefits, right? So there are some very basic math problems here. And so you cannot, as Regina said, having children is a risk, right? So you cannot sustain a family on a minimum wage or even a $15 an hour job. If there's any sort of issue that comes up during a month, and there's always an issue that comes up during the month. So the other thing I want to speak to that Regina talked about is this disproportionality for people of color. So she mentioned that about 24% of our population is African American. More than 70% of the families we serve are African American. So well outside of the norm. And so when we look across the country at the statistics, what we see is that about 1/3 of those who are experiencing homelessness are families with children. And most of those are single parent, single female heads of household with children, about half of whom have a high school diploma or less. And so you see that we cannot, as Regina pointed out, we cannot acquire the skill set and the job, the income level to sustain any sort of family. And the other contributing factor that I want to point out is a lot of the women we serve who have children had a teenage pregnancy. So if you look at the research on this, you see teenage pregnancy, growing up in poverty, it's almost an equation for future homelessness. So these are all very interconnected issues. And about 25% of the families we serve have a child in the household who has a significant disability. So we're talking about kids who have severe autism, who have cerebral palsy, who may have both. There's only so many times that a single mom can leave her hourly wage job to go get that kid and still be able to pay the rent. So these are all very intertwined and complex issues. There is no silver bullet. This is trying to fix long-term systemic issues, as Regina said. We need work in our healthcare system. We need work in our education system. We need work in this growing income disparity. issue. We need to raise people up and help them earn more money, get the education that they need, and to honestly unwind sometimes years and years and years of trauma that particularly single female heads of household have experienced. So we're talking about females who've had some sort of early childhood sexual abuse, who have then gone on to a domestic violence relationship, who have a lot to unwind and uncover. And that often comes with a significant amount of trust building and working over a number of years with people. So this is not an easy fix. We have a lot to unwind and unpack. And I would just also point out that during the pandemic, we have seen our rates of need really go up. So we typically will get 300 to 400 calls a month for people needing assistance. And they don't typically reach out to us unless they're pretty dire. Over the last 5 months, that's been about 1,600 calls a month. So we've seen that dramatically increase. We've also typically put about 30 new families a month in shelter after we've tried every other remedy, eviction prevention, negotiating with landlords, trying to relocate them, giving them rental assistance. So about 30 new families a month have needed to go into shelter. But over the last 5 months, 60 new families a month have needed to go into shelter. So doubling, and we just don't have that capacity. So we have really had to expand our services and then go even beyond that. And so we're currently putting people into hotel rooms to keep them from being seen out on the street, from sleeping under bridges and such.
Is there something that you've seen, Ellen, that either from a policy standpoint or at any level that's really kind of impacted the numbers of people who you're seeing? Like why is it the last 5 months? So
yeah, absolutely. We saw some pretty dramatic declines in service need, both in 2020 and in 2021. And that decline, which you can actually see in our data exactly when stimulus money hit. And when, if you remember last year, we were paying an extra $600 a week in unemployment benefits. You can see exactly in our charts, in our call center charts, when that hit, because our call volume plummeted. And you can see it continue to plummet, while people who got a little bit of extra help were able to fend for themselves. And then you can see in the data exactly when those extra unemployment benefits expired and when that extra stimulus money expired. And those numbers shot right back up again. We saw exactly the same thing in 2021. When stimulus money hit, we had an extra $300 a week of unemployment benefits. You could see where in Texas, when the court in Texas decided that they didn't have to pay attention to the CDC ban on evictions, you can see those numbers go right back up again. So there are some really interesting dynamics when in the sort of the big macro environment that we've felt very distinctly in the micro environment when those big policy shifts happen. I never thought I would be an Andrew Yang fan, but then I see, wow, this universal income thing really works. I mean, you put the hands and the money of people and they fend for themselves, and then that money goes away and they need services again. So that's been really interesting. And then the other thing I would say is over the last month or so, we've been able to access through some of the newer policies, some new emergency housing vouchers, which our area, which is Dallas and Collin County, is allocating for either very large families or families who have a disabled child. And these are vouchers that will pay for rent for the long term. And we've been able to see some families really be able to recover and get back out there, which is nice to see. So I think when we get an inflow of funds, either directly to families or we get an inflow of funds to help us house families, then we're able to help people get back on their feet.
Yeah. I'm at heart probably a numbers geek and a wonk, despite the fact that we would never necessarily know that if you looked at my background. So I could talk these numbers and data all day, but I'm just really curious if there's, you know, I mean, these numbers have personal, I mean, there are faces and people and lives attached to the numbers. And I'm curious whether there have been any stories over the last 5 months or longer that have stuck with you from the work that you do that's maybe a positive outcome or a telling tale of what we've been talking about and the impact of our policies.
I can tell you, and this isn't about policies, but I can tell you from a sense of community, and I don't know, I guess I'm telling my age if I say that, you know, I used to watch Captain Kangaroo when I was little, and Captain Kangaroo used to do this one parable or this one story, Stone Soup, if y'all remember that. And it was a little village, and nobody would the two, you know, vagabonds, they called them, we would call them homeless, went door to door asking for a bit of food, right? And they were turned away summarily, and they went off into the woods and they found this old rusted pot, and they washed it off and filled it with some water from the stream and built a fire in the middle of the village. And they very ceremoniously dumped these big stones in, and were stirring and wafting, and people were looking out their curtains very curiously. And they came out and they said, "What are you making?" "It's stone soup." I said, "May I taste it?" No. You can't taste it. And, you know, you have to give us a little something. They said, "Well, what can I give you?" And they said, "Well, how about a bit of carrot?" The next person comes out, "How about a bit of potato? How about a ham bone? How about this?" In the end, everyone contributed to this stone soup, and it nourished the whole community. And that, to me, is what we do as a community, both nonprofit and for-profit, when we work together. And I'll tell you a small little vignette in the middle of this. I don't know if you all know that the restaurant Dream Cafe, Mary O'Brien's had Dream Cafe for 30-something years, probably one of the oldest female-owned restaurants in town. And she saw what Wings was doing, and she's a childhood friend of mine. We grew up in Indiana together. She reached out to me and she said, "I want to help these women and children that you are supporting." And at first she said, I would like to give hot meals, but she said, the more I learn about what you guys do and you teach people to fish, you don't just hand them fish, I want to support what you're doing. So she started meal kits. She had a regular customer who gave her the money for the food. And we did this for 14 months. Every week, we did 20 meal kits to moms and families. And in each meal kit were 5 recipes. And the food, and I mean, if it said a pat of butter, everything but salt and pepper. She put everything in there. And they were nutritious, low-cost meals where she wanted to give them dignity, not just hand them food, but give them the dignity to cook for their family. And I mean, if you needed a tablespoon of olive oil, there it was. Everything you needed. And she built this over 14 months. And we rotated through our client base that these women had the dignity to provide for their families. And they were learning how to shop smart, and they got recipes, and they got this whole thing. It was the coolest thing. And I love that Mary and her team did that, and we'd go deliver them to everybody every week. And it was such a cool thing. And that wasn't a policy, and that wasn't it was just somebody that said, I'm going to help these women. And that was one of the most positive things that came out. We all have great stories of wonderful humanity in the last year and a half. That, to me, for our organization, I will never forget what she and her team at Dream Cafe did for 14 months for our clients. It was amazing.
That's great.
That's an incredible.
It really is.
I get super clamped when I think of it.
We have so many families that we serve, and we've been around for 35 years, founded by Annette Strauss, of course, and her family's still involved with us, which we adore. But I was thinking about a family that we served in our new facility in far north Dallas. So we contracted with the city after a competition to enable us to take over an old hotel that has kitchenettes, so that we could dramatically increase our capacity for family shelter, because during the pandemic we needed so much more. So we started a 50-room family shelter in an old Candlewood Suites hotel, which, to your point, Kate Rose, they get to prepare their own meals in their own kitchens, which has really been a blessing. But we have a family who's recently moved out, who is a single female head of household, who had 2 sets of twins and then another child. So she had 5 children of her own. And then her sister became desperately drug addicted and could not care for her 3 children. And so this single mother with 5 kids of her own, including 2 sets of twins, adopted her 3 children from her sister. So single mother with 8 children now, was living in a home and had trained as a cosmetologist. And so out of her home, she was operating and braiding hair and doing makeup and doing all of these things to sustain her very large family on her own when the pandemic hit. And then, of course, her clientele completely dried up because nobody was going out to get those services. So she lost her housing. So then she and the 8 children were living out of her car, and the car was not big enough. So sometimes the children would sleep, some children would sleep in the trunk of the car at night. And so it just gets worse and worse. And she kept them in school. I don't know how she did it. Kept them in school. She was shopping in Walmart one day to try and gather some provisions, and she came out and her car had been repossessed in the Walmart parking lot. And so then she reached out to us. So part of this message is trying to get families to come to us before we get to this dire circumstance, of course. But here she is without a car even to pick up the children from school. She's lost her housing, she's lost her income, and then someone recommended that she call us. So she was in our hotel, of course, needed 2 hotel rooms for that large of a family. And she has been one of the recipients of these emergency housing vouchers. And if there was ever a family that is perfect for that, and I didn't tell you that one of these children is severely disabled, and she was carrying this child around. We, of course, got him a wheelchair. So these are families who are, I mean, honestly, I don't know how she did it, how she went so long on her own without support. But these are the types of women that we are working with, who have this incredible grit and determination. And now we've been able to move her from the hotel where she's waiting on her last inspection of a house so that she can have her life restabilized. But there are thousands of those kinds of stories. And these are not people who are trying to game the system, which of course there's this mythology about. These are real families with real struggles who, honestly, if you or I were in these places, we would probably crumble, but they managed to maintain, which is always a miracle.
I think these are the stories of resiliency that we hear so frequently. But Shannon, I think one of the issues I think that permeated some of our discussions as we were having the Mayor's Task Force on Poverty was that, you know, we tended to think about those people that, and I think that Ellen was mentioning that we see underneath the, you know, the overpass and you know, are panhandling from us, et cetera. But as we try to describe the working poor, we said, you are seeing the working poor. They're the ones that are filling your orders when you go through that drive-through. They're the ones that are putting up your holiday lights. They're the ones that are mowing your lawn. They're the ones that are taking care of your parents, of your kids. And so that has been the issue. That's really Dallas. It is the tale of 2 cities. It's a tale of those that have done very well in these neighborhoods that don't have concentrated poverty. And then the other neighborhoods where the parents want exactly the same thing. I mean, I think that Ellen's description of this amazing woman was that she was trying for the best for her kids, no different than any of us on this phone call, any of us that are listening to this, always wanting the best for your kids. That's what this is all about. And that's why it's so important to have these discussions, because these are folks that are absolutely willing to work. I mean, when you think of some of the stories of how many hours some of these folks have stayed on buses to get to a job, how many of them have done exactly what Ellen was saying, just are resilient. They just get through it and they do it. But think about that kind of grit and determination. So how is it that we can channel that? Because as Kate Rose was saying, that's what really improves the entire community for everybody when you're able to find that kind of success.
Absolutely true. And I just want to encourage everybody who is out there on the call to put in any of your questions in the chat, because we're going to head that direction. But kind of moving forward a little bit, I think the work that everybody has done has clearly had some big successes. But are there any initiatives or things that you've seen maybe in other parts of Dallas, maybe in other parts of Texas, other countries, that you have really been interested in, that have been able, you've seen them that maybe have been able to move the dial? So like I guess what I'm getting down to is, what are the things that we can really do to, change the trajectory for the people who are caught in the cycles of poverty?
One of the things that I would mention, Shannon, is that we have to be able to deliver services to people more easily in Dallas. Here is one of the things that we did discover in our task force on poverty. It is expensive to be poor in Dallas. You make it really tough on people who are poor in Dallas because they've got to go to so many different venues. And I'll give you an example. Back when I was in the healthcare area of something that we did in Dallas, back in 1993 or so, Dallas decided that Parkland was going to be taking care of those that say were on Medicaid, but they were the adults, and all of the kids were going to go to Children's Medical Center. And that was decided. And so right now, if you go into Parkland, into their big, beautiful new facility, the only kids you'll see there are those that are in the NICU, the neonatal intensive care unit, and then some that might be, thankfully, not very many in the burn unit. And that was sort of the way it was going to be. So let's say you have that baby, you then find out, no, we're so thankful here that you've had this baby here at Parkland, but now you're going to have to go over to Children's. And then, by the way, when you start getting your immunizations, you're going to have to go over to the county. So that's where you're going to have to go, where we make it so difficult. And we still do a little bit of that, even now, where we have built big boxes, where folks have to go to the big boxes. You saw that even as we were giving food in the pandemic, you had to go somewhere. It wasn't coming to you and to the community. Houston does that differently. Houston has this very large organization called Baker Ripley, which is the largest nonprofit in Texas. And part of what they do is that they have these vans that go out into the community and take out resources. So the one thing that we were saying is that if we could do a better job in Dallas with what is called wraparound services, where it is where it is one-stop shopping for things that you need, instead of having to go to so many different places and then catch as catch can in terms of finding out where those places are and what you need to do. That to me would be one, and that was one of the recommendations that we made, is that we would have more of those kinds of facilities. But what happened during the pandemic? We closed libraries, we closed the centers. So you were then really telling people that you're now going to have to fend for yourself to figure out where all of these different opportunities are. So not a big surprise that Ellen doesn't hear from people until the very last moment, because there isn't an easy way to understand how to be able to do that. So if there was that, if I could give a magic bullet, the one thing that could change things, it would be to create a systemic way of approaching these issues for people that would be like a wraparound service where we go to them and we respect them. Instead of making them come to us, we go to them.
Yeah, Regina, one of the things that we've done at Wings, and Regina is familiar with this, about this time last year, we took a step back into the strategic plan, because we knew that whatever was the normal prior to was not going to be coming out. And we wanted to look at where our program's still relevant to the community we serve. And the other thing we looked at is the delivery model efficient and effective. And what we determined through this multi-month review is that our programs are relevant. However, our delivery model needed to change. And what we have done over the summer is we have completely changed the way we're delivering our services. We're no longer doing our services at our building on Inwood and Maple. We are starting to do place-based programming where we are partnering with non-redundant nonprofits that are serving the same population that we are serving. And our first collaboration, we've collaborated with dozens of organizations, but I'm talking about going into their space. Our first one is Crossroads Community Services in the old North Texas Food Bank space. We are working with them. We're doing a 3-year program with them. UT Southwestern's bringing in a research piece. And we are working on financial coaching with Crossroads Community Services clients. We have another one we just nailed down 2 weeks ago with DEC. DEC is there to get more minority people opening businesses. Well, they have the infrastructure to lead the women-owned businesses piece to get the cohorts for business plans, but they didn't have the financial coaching piece. So we're going in there and we're going to be working with their clients, and we're going to be doing the financial coaching with them so they can get their financial house in order. And we're going to where they are. We're not making them come to us. And we're finding that is a huge difference in how we are able to support these women and remove some of those barriers of transportation, remove childcare, remove time. It's a lot easier for a woman to get to a class or get with her coach when it's a mile away and not, a 2-hour bus ride with 2 transfers. So it's a huge difference in the way we're doing things.
It really makes a difference. I'll just point out one thing that we are experimenting with and want to expand on is this idea of taking our resources into what we would call resource deserts, which are communities that have very poor transportation, very low self-advocacy skills, and have a lot of just poverty and impoverishment everywhere. And so we've partnered up with the Child Poverty Action Lab, and they have identified a couple of schools that are known to be the highest for mid-school year transfers. So it means people are getting evicted and moving their kids. And we're starting to go into those schools now to build trust, because trust is critical, and get to know the counselors and the principals and the teachers so that they can help us identify and we can be present for families who might be able to come to us before they get to that place of crisis. So if they know that we're regularly on the campus, that they might be more inclined to come to us and ask us for help for rent, because we can help people with rental assistance. They don't have to be evicted. They don't have to be even in the eviction process. But what typically happens for us is more than 50% of the families who reach out to us for care are living in their cars, or they've moved into a hotel room because they've left their lease. And they haven't left their lease because they're in an eviction process. They've left their lease because they've been threatened with an eviction. So it's not the formal process. So we're not getting to them early enough. If they had come to us earlier, we could have paid their rent for them and wrapped around services to keep them stabilized. But once they're in their car or their hotel, we can no longer advocate with that landlord. So then we have to start from square one. So we're trying to figure out how to leverage some of these other partnerships in the community to get to these places where we know there are very high risk populations, but we sort of need to retool and restaff to support that effort. So that's one of the things we're working on in our new budget year.
And Ellen, I think one thing we should point out too is that when that eviction occurs, and then let's say you do a little bit better and you're trying to get your apartment or a rental of some sort, you will not qualify for anything until you've paid the previous.
You have to pay the old eviction.
To pay the old eviction. And that is in itself the barrier to move on into something else, and it just spirals.
No,
and
it's right.
The whole point of this is to stop the spiraling, stop the snowball effect, because it just creates even bigger problems. But that is the way. And, you know, sometimes we think about systems not working very well on getting information. That system's got to be one of the best in the world.
Works.
I mean, it works really well from every account that I've heard of.
It worked. No, you're absolutely right. So once there's an eviction to be paid, in order for us to rehouse someone, we have to pay that eviction. So it's coming out of our funds. And so if we could just catch them before they're evicted, we would pay much less and we could keep them stabilized. So we're trying to go further upstream, but boy, upstream is tough.
So we have had a couple of questions come in from the audience. And one of the questions that we've had was, are we doing any better with childcare, given how much of a huge impact it's had for women with children?
I think we've lost 30 or 40% of our childcare workforce across the country during the pandemic. We're really struggling with this, with our families who are desperate to work. We're now in a position where we are providing laptops to moms to help them work online because their kids from home, because their kids can't get into childcare. And so we are fingers crossed for universal pre-K going earlier and earlier so that we can get some of these kids into care, because we've really lost a lot of ground in this area. I don't know if you guys are seeing the same thing, Kate Rose.
Yes, we are. We're seeing the challenge for these women who are the single head of household. I know that Capital One, I don't know if y'all from the Capital One's Insight Center, they have been doing talking to people, thousands of people every 4 weeks throughout the pandemic. And the most recent data they have is from August of this year. And in the area of childcare, they're saying that 50% of low-income wage earners, women, had to leave the market because they didn't have reliable childcare, and that's only compared to 18% of high-income workers. That's just it. If you look at that again, it's kind of like you were saying before about Shannon, about the different things that hit people. It's just a Venn diagram, and yet another, and yet another, and yet another. And when you look at that, that has to be solved. That's not our wheelhouse, right? We don't do that, but we work with moms every day and try to help them solve that from a budgeting, or we collaborate with other nonprofits to cobble together resources for them.
The other side of that coin is that when we were looking at the task force, the childcare employment opportunities, those that were the childcare givers in some of the communities of color, that was a job that number of women who would do kind of their own little shops in their homes to take care of children. That was another one of those kinds of employment opportunities that went away. And so not only now do you see the fact that we are under-resourced, but think about all of those previous entrepreneurs who had those childcare facilities in their home, taking care of 3 or 4 kids. They lost in their employment opportunities as well, because, you know, parents were taking their kids out, or they didn't want to put them in anymore with other kids. And that created a huge issue, particularly in some of our communities in South Dallas.
I noticed another question that popped up, and the question was, you know, there's just so much. Where should we start? And I'm going to just hop in a little bit there myself and throw out and circle back to Regina, what Regina was talking about the wraparound services and the partnerships and the bringing the services to where the people who need them are, rather than requiring them to go there. So, you know, I feel like there isn't, you know, end to the levers, which I know Regina and I have talked about before, because that's one of my, I've had that conversation throughout my career with a number of people who want, you know, what's the right lever, what's the right button or switch to flip to push the magic bullet. And, you know, we can't do just one, we have to do it all. And we can't do it alone. So I think one of the amazing things that I've heard in this conversation from everybody is the rich partnerships that are being formed out of necessity in order to do the work that needs to be done, and the flexibility to shift gears so that the needs that are immediate are the ones that are being met, and not just these are our services and they may or may not work for you. So that's my 2 cents in that question, but you all might have some other perspectives about where do we start. So
Well, I will say that we changed our entire model of operating. I've only been with the agency about 5.5 years, and about 4.5 years ago, once I got my feet on the ground, we shifted from being a single facility focused on, we're going to serve 35 families in this family shelter that Annette Strauss founded for us. And then we're going to rehouse them and have some housing opportunities. We completely shifted and said, what about the rest of the need? And we started collecting data and looking at national research, looking at best practices, and started an entirely different way of operating, away from a first come, first serve model, which is how most shelters operate, and into an assessment and diversion model, which actually, I think there's someone from the Zale Foundation on this call with us today, and they seed funded that, which has dramatically changed how we operate. And so we now assess families on what they need and try to connect them to the right path. And when we no longer assume that everybody who's calling for shelter actually needs shelter, that if we just sit with them and understand their story and understand what their strengths are and what their opportunities are, that we can help them connect to their own resources and their own path forward that may not even involve us. And so when we stop thinking that this is our service package and it's all we deliver, and we start thinking about what do you need, I think that's a game changer. At least it was for us.
Yeah, I agree with that. I think that many nonprofits, and I know, Ellen, that we refer clients, and we have some stories there between our 2 organizations. But many nonprofits here in town are very good at collaborating and supporting. In our case, supporting women that need more than what we provide, and we all know each other's work very well, and we're all able to say, without just saying here's a phone number, but we actually bring them in and kind of case manage together, so that we're making a woman who's already just overwhelmed, right, and has just doesn't have the bandwidth. We try to support her and her family in getting the resources that they need. But I think that collaboration amongst the nonprofits, like I was just on a call this morning for, I don't know, an hour and a half, the Dallas Housing Authority hosted, and there was about, I don't know, 25 of us on there. All different agencies were talking about how we can support each other and support support the people in our community. But I think, again, I go back to that for-profit, not-for-profit partnership. We've got an initiative we're calling the Southern Dallas Initiative, where we're doing this place-based programming, and it's different, and it takes different tool sets, and we've actually not gutted, but changed around our economic advancement team and added some positions and done some things. We have some tremendous corporate partners that are helping us get that done, and they believe in what we're doing, and they're willing to stand in the gap for us and for these women in our community. And I think that can't be emphasized enough.
I think that's true. I think a unique benefit, if there is one, that the pandemic brought is that it forced us to really look hard at how we were functioning. And I can tell you that for the first 13 months of the pandemic, there were a group of us who met every single day.
Right.
every day
Every day.
from multiple organizations
Yep.
trying to figure things out together. And that level of partnership, even though we don't meet every day, now we just meet once a week. That level of partnership has driven so many important changes and creative ways of thinking and operating that I don't think we would have done if we hadn't been forced into this. We don't know what to do now.
There would have been task force that studied it forever. That's why I said
Yeah.
when the pandemic hit, we went fully virtual in 72 hours. Now, if we had said to our board, in January of 2020, hey, we would like to start doing virtual, there would have been a subcommittee and a study and a this and a that. There have been all kinds of stuff. We shut down on a Thursday and we're fully virtual on a Tuesday. We never missed a beat in our programming. And the first couple of weeks, it was pretty ugly, but we got it done and we got better and better at it. And I think the pandemic made that change, length of change, much, it was truncated. Yeah, much truncated. And it also, it instilled a lot of creativity.
Yeah.
I
We
think
couldn't close, but we had to figure out how to operate and expand while everybody else pulled back. It really drove some real innovation, I think.
And Shannon, kind of hearing a little bit of what just in this comment, and you mentioned best practices. One of the best practices that we saw as we were going through and we reviewed so many cities and what we saw there. One of those was actually in New York, and it was started by Mayor Bloomberg when he was mayor. And it was called a Center for Economic Opportunity. And part of it was, now New York is a lot different. I mean, it's a different kind of system in terms of how much power the mayor has, which is enormous there, not so much here. But what's interesting is that the Center for Economic Opportunity that he started, called CEO, which was to kind of get to the corporate side on it. The important part of that is it did exactly what Ellen was saying, bringing in people kind of doing this. And it wasn't just the city then. In this case, you needed to bring in the county because that's where the healthcare comes in. You need somebody ask the question about evictions and how do we not sort of talk to each other? That would be the way to do that, but it never goes anywhere on it because, this one is worried about losing power and this one is losing this. And the question then is, at what point do we just say, these are services that we are all paying for, let's just make it more accessible. And that perhaps is one of those best practices that I saw that then Mayor Bloomberg was able to do to bring these entities together. And one of his big issues on this is he did not want to see the disparities of the huge disparities that he knew could happen in New York with these, multi-billionaires and then others living, in very difficult circumstances. They actually didn't have as high inequities as Dallas has had. But part of that was an intentional way of looking at the ways that you could break that down, have those discussions, and then ensure that you wouldn't have the economic disparities and inequities that you see in the system.
And we had so much more we could talk about, but it is already 8:15. And I do think, I have great hope and faith in Dallas being able to come up with some of the most creative ways to come together and address some of these issues in a big way, in the wraparound way, in the way that Baker really does in Houston and Bloomberg did in New York. I think Dallas has that. We have that potential in us. So I'm signing on to help make that happen. But I did want to read a comment from Rosie Stromberg that was in our chat, and it's really it gets kind of at the very beginning of a lot of the problem, Ellen, that you were talking about, and maybe something that we could do in more of the immediate. And that was, she said, at the policy level, could we advocate for the city or county to require that landlords notify city staff or county services when the court eviction is underway, so no families end up unsheltered? So is there some way that the shelter system, that Family Gateway and others who are working in that area get notified of somebody before they do fall off that cliff? If not, who should we talk to?
No, it's a great suggestion. There's actually been an entirely new nonprofit emerge as part of this eviction process. An attorney named Mark Melton has just jumped in full force and with a whole cadre of volunteer attorneys to try to get further upstream to catch these things. And they're now embedded, as are many nonprofits, in the JP courts to try and catch the evictions at that place. Our problem is at that place where the landlords are threatening an eviction and then families move before they go through a formal process. And I think our state is very pro-business and very pro-landlord, and that's going to take some unwinding to do to make it a requirement to notify before an eviction process is started. But that would certainly be a benefit, because there's so much money right now for eviction prevention that it's almost hard to give it away because we're not getting enough families connected to it.
All right. Thank you all so much. It was a fascinating conversation, and there's, so much work that continues to need to be done. And NCJW is here, and we appreciate the work that you all are doing. And we look forward to continuing the conversation and continuing the work as we go forward. So I want to thank everybody who joined us today, and also let everybody who is on the call know that December 14th will be our winter meeting. We will have Dion Kirby from the Dallas Dinner Table will be joining us at that breakfast meeting to talk about Dallas Dinner Table and how we might get involved there as well. So thank you all, and enjoy the rest of your evenings.
Thank you. Bye-bye.